Okay, hello, hello, hello. Tad Stevens with MediaMarket.tv here. Today we are interviewing Dr. Hock with Evergreen Vision Clinic. Dr. Hock, how are you doing?
I'm doing great. Thank you, Tad.
All right. We got quite a bit to cover today, so let's jump right in it. When people think of an eye doctor, they're often confused between ophthalmologist and optometrist. Can you talk a little bit about the difference and which doctor should we see?
Sure, Tad, I'd be happy to. It's a really common question, and it's a little bit confusing, but ophthalmologists are medical doctors that specialize in 6 subspecialties. They're typically surgeons. Optometrists are the primary care eye doctor, and so we treat and diagnose eye disease, and then if there is it's necessary to send a patient off for surgery, then we send them to the appropriate surgeon, and in that case that would be sending them to the ophthalmologist. That's dependent upon the condition that they have. So optometrists are the gatekeeper and the routine vision care provider. Ophthalmologists are the specialists and the surgeons that fix more complicated eye disease and surgery.
Okay, that helps a lot. Is there anything else that an optometrist, does that we would know about or that we would want to know about?
Yeah, so optometrists, of course, we fill prescriptions for glasses, for contact lenses, and then, of course, we treat the major eye diseases, the glaucoma, macular degeneration. We provide care for people who have diabetes, because there's a lot of vision problems that people with diabetes, it can affect their retinas. And so we provide all of the services for just the routine eye disease type of stuff that we see on a daily basis. And then again, we will refer to the appropriate subspecialist dependent upon what the issues are that we need to see an ophthalmologist for. So optometrists also we work with children who have vision problems that affect learning, and I'll get into that a little bit more here in a few minutes. But again, optometry is the gatekeeper and the primary care profession for eyes and vision care.
Okay, outstanding. Sounds like you do a lot. What sort of equipment do you have available in your office, and what do you use it for? What's it test for?
Well, Tad, my clinic here at Evergreen Vision Clinic, we have all the latest technologies to try. We really believe that in advancing our technology to better serve our patients, and we have technology where we can do laser photography of the retina. That's really really important, because we can establish a baseline and do a longitudinal study over time as to a patient's retinal health. We also have other machines that can help us with the diagnosis of glaucoma and macular degeneration, and we can follow these people over time with some baseline findings. We have devices that we can analyze people's nutritional status, and we can also determine genetics by doing a cheek swab, and we can look into their DNA, and we can offer very individually specific nutritional recommendations. We can also look at hormone levels, and we can determine if there's high or low levels of micronutrients, and so we can get really specific as to diet and health. And what we found, there's a lot of recent research that nutrition plays a role, of course, in all health, but it certainly plays a role in a lot of the eye diseases that we see. And by doing nutritional counseling, we can help our patients prevent or slow down the progression of these common eye diseases. Specifically, I'll mention that diabetes is such a big one, because this country is really getting to almost epidemic proportions of our country being diabetic or pre-diabetic, and it's really important for the optometrist to look at the retina and determine if there are issues with the diabetes in the retina, and then we can get into contact with the primary care physician or the endocrinologist who manages their diabetes and help them manage their disease more effectively and keep them from going blind.
Wow, sounds incredible and extremely important. Are there any other services, or do you provide any other special services that other eye professionals don't?
Well, we certainly do here at Evergreen Vision Clinic. It's really important, if you have a child or if you know of a child who has vision problems or has, I should say, has learning problems, to evaluate their visual system to determine that that vision is or is not a factor in their learning problem. These kids need to be evaluated specifically by what's called a developmental optometrist, and developmental optometrists specialize in diagnosing and treating these issues with vision that affect learning and reading. And so if there are problems that glasses won't solve, then we do something called vision therapy, and again, these are treatments to help children, to help them track better, to help them focus better, to help them use both eyes and have better binocular vision. And these services can directly impact a child's life in that we can make them better students, better learners, and it's an incredible service. These services are not provided by most eye doctors. You do have to specialize in it.
Okay. Let's change subject here a little bit. Glasses. When it comes to glasses, people are often very confused about all the choices, all the terms involved, anti-reflective coating, UV protection, Polaroid, etc. Can you give us some guidance on what we really need?
Yeah, I can. It's individually specific, and so if you are somebody who spends a lot of time, say, on snow or on water, then you want to have polarized lenses in your sunglasses. If you're somebody who does much computer work or does public speaking, you definitely want anti-reflective coating on your lenses to cut down on glare and to make it so that you don't get. It makes it so that you're more comfortable when you're working on computers. There's lenses that can, if you have a real high prescription, that can make it so that your lenses are much thinner and lighter. There's a new lens technology that puts a melanin or a pigment into the lens that decreases blue light for computer users and people who have a genetic predisposition for macular degeneration. So there's all kinds of new technologies and new lens choices that we can give. And again, what's important is that you spend some time with your doctor to go over what your lifestyle needs are, and then your doctor can make recommendations that are very specific to you as to what lenses are going to work best for you.
Okay, outstanding. That helps a lot as well. To get a little personal here, why would somebody come to Evergreen Vision?
Well, here at Evergreen Vision Clinic, we have a staff that is absolutely passionate about what we do. The doctors and staff here, we love what we do, and we're passionate about helping people achieve optimal vision, and in doing so, giving them a better quality of life. We love what we do, and I have a wonderful support team and another doctor, Dr. Nicole Wellenseek, that I work with, that we are really passionate about providing our patients the best.
All right. Okay, again, I'm going to change subjects here a little bit. I have heard that you can actually save someone's life by doing an eye exam. Can you tell us about that? Give us some details.
Sure. There's a lot of things that optometrists do, and we often are some of the first people to diagnose things like high blood pressure and diabetes, and those certainly can affect life, or quality of life, and can even lead to death. But what I wanted to mention is that there's a program, and it's called Infant C. And Infant C is a program where we do a vision assessment. It's no charge to children or infants from 12 months in age. We like to do it down to from 6 months to 12 months, and we're looking for things like a lazy eye or an eye that crosses. But one of the things that we also look for is a certain type of eye cancer that's very rapidly developing in infants. It's called retinoblastoma, and with this infancy program, several children's lives have been saved by identifying a retinoblastoma early and getting it treated.
Wow. Why don't other eye care professionals offer these services?
Well, I'll tell you, as far as some of the pediatric services, it takes a specialized doctor and there's a lot of training that you have to do to become a developmental optometrist, somebody who works in pediatrics. And the reality is that a lot of doctors just don't go through this training. It takes years, and there's a very long process that you have to go through to ensure that you have to pass a board. And most eye doctors don't do that. There's an organization, it's called the College of Optometrists and Vision Development. Their website is covd.org, and you can look at that website. You can actually type in a zip code, and they'll tell you if there are doctors with these certifications in your area.
Okay, great, and we will make sure that we have that that website address in the description if anybody wants to check that out. Dr. Hock, that is super. Very, very informative, very, very helpful. Is there anything else that you would like to tell us about yourself, your staff, your clinic, anything at all?
Well, I just would like to say thanks for taking the time to talk to me today, and if you have anybody that has any issues regarding vision and eye health, please give us a call or find us on our website, which is evergreenvision.com.
Okay, outstanding, super. Thank you very much. Thank you, everybody, for watching again. This is Tad Stevens with MediaMarket.tv. We have enjoyed interviewing Dr. Hock and you watching with us here today. So we're going to call it a day on this one, and we will see you on the next one. Have a great day.